Hi, my name is Alyssa, and I'm the student nurse who's helping you today. When I first said that sentence, my voice was shaking. The second time, my palms were sweaty. As I continued to say it, I became more comfortable with what it means. When nursing school began, I had no idea how it would shape me into the person I am today. We started with the basics of patient care, washing our hands correctly and giving bed baths. As it turns out, sterile gloves don't go on easily with an audience. Then, we arrived at day one of clinical. Remember going back and forth with your partner about who should go in the room first? Remember not knowing the first thing about how to get a patient ready for the day? But also, remember weeks later, when you finally got your patient ready 15 minutes early. For me, that moment was shared with Emily Guida. Dressed in her favorite outfit with me playing the piano, our patient broke into a huge smile. It was at this moment I realized that taking the time to do a little extra makes all the difference. Fast forward to spring 2020, when COVID first hit. Clinicals were over Zoom in my scrub top and pajamas, and I was doing assessments on a Squishmallow. Virtual patients were dying because I didn't press the right button at the right time. At the time, it was discouraging not working with real people, and it was a shared feeling that we weren't going to be good nurses. At the end of it all, however, I learned two important lessons. Lesson 1, school is important, but grades and skills aren't what make a good nurse. Setting up an IV pump or inserting a catheter will come with time, but genuine compassion and empathy can't be taught or tested. What makes a good nurse is someone who will go the extra mile to make patients happy and comfortable. A good nurse has a genuine desire to connect and understand without judgment. Patients are not a task to complete, but human beings. Finding this inside yourself is more important than any skill. We will be great nurses. We know more than we think. Stay eager to learn and don't be afraid to admit what you don't know, even as an expert. Lesson 2, tomorrow is not promised. Most of us are super type A and have the next 10 years of our lives planned. But who could have predicted a global pandemic? It highlighted the fragility of life and the importance of living for the moment, because you can't change the past and the future doesn't exist yet. Focus on cultivating meaningful relationships, taking care of yourself, and developing into who you aspire to be. Make sure you're happy, because anything that costs your peace is too expensive. Life happens, and it all works out, so let it. We are flexible and resilient, and that is what will take us far. Our experience has been unlike any other, but we have adapted to change beyond our control with grace. Despite the frustration, our desire to learn and connect with others never wavered. As a class, we have overcome so many obstacles, but always leaned on each other. You have been the greatest classmates, but more importantly, the greatest friends. Some of us will be at the bedside, while others become nurse practitioners, nurse anesthetists, nurse educators, and the list goes on. We sit and think about the future ahead, waiting to unlock our full potential. No matter what you do after Decker, do it with love and kindness in your heart and passion in your soul. Remember that people are what matter, and you have the ability to change lives, even in small ways. Take care of yourselves, so you can take care of others fully. You are one person with two hands and one brain. Don't let the difficulty and busy nature of this career turn you cold, but instead, know that some days will be good and others could be better, but in the end, you chose to be a nurse for a reason. It takes a special person to be a nurse. I'm proud of you. The faculty and staff are proud of you. Even Walter Matthews is proud of you. I want to close by saying thank you. I have so much love for and would be nothing without the people around me. To my peers and professors, you have given me confidence and prepared me for the world. To the advising office for watching me grow into myself over the years. To the healthcare workers who have been on the front lines. And most importantly, to my family. Dad and Ma, I hope I've made you proud, and I know my mom is looking down on me in this moment. When I first came to Binghamton, I had no idea what the next 4 years had in store, but this is where I was meant to be. The next time I see a patient, I'll be saying, "Hi, my name is Alyssa, and I'm going to be your nurse today."